Now, what was the plan in terms of her going back to Ohio? I don't follow you. She was supposed to call as soon as she got home? Well, yes. And I wanted her to call me when she got out to Ohio State, and we had a list of board-certified plastic surgeons in every town in the United States. And I was going to get in touch with one of the plastic surgeons there who was board-certified and have him or her follow Kate while she was at Ohio State. Now, during the direct examination, Ms. Ott asked you questions about telephone calls on the 24th. Let's go over that note now. Okay. She asked you whether Kate had called. Remember those questions? Somewhat, yes. And you do remember those questions? I do, yes. Doctor, after the 16th, did you keep in contact with Dr. Berg? Yes, I did. Did you also keep in contact with Kate? Yes, I did. And the purpose of keeping in contact with Kate was what? Well, if she's my patient, I mean, even though I feel I was very upset and concerned about this complication, and she was going to be in college away, but I still wanted to maintain some sort of understanding about what was going on, and then when she would be back east, I wanted to see her at the office as well, but I wanted to make sure she had a proper continuity of care by somebody that would really be adept at treating those soft tissue problems. Defendant's counsel, move to strike. The witness is wandering all over the lot. The court overruled, motion denied at this time. Did she come back to your office after the 16th of September? Yes, she did. And did you see her in the office the next time? Would have been October 11th? Yes. Okay, now at that time you describe in your note your findings and the treatment. At that point in time, with regard to most of the incision, what do you say about that? In this note? In the note of October 11th. Most of it looks reasonably healthy now. I would think that it's going to start to contract in and close fairly well. Basically, it is a separation between the skin of the flap superiorly and the remaining healthy tissue of the particle, or pedicle. This should close, but it is probably going to take about 3 months. I went over the options for reconstruction at a later date with Kate and her mother. I will see her back when she returns over Thanksgiving vacation. Defendant's counsel, Your Honor, I just object that he's read not all of the note, but skipped the first couple of sentences of the note. The court, then you can do that on redirect, sir. Plaintiff's counsel, she read that already on direct, Your Honor. I'm completing that note. The court, listen, if she wants to read them again on redirect, it's all right. Next question. Doctor, with regard to the options for reconstruction, did you know exactly what reconstruction would entail at this point? Well, at this point, the wound had not closed, and I didn't see what the final outcome of the scarring looked like, so it was premature. I just wanted to let the patient's family know that there is a good possibility that some further work may have to be necessary in order to improve the appearance, but at a later date, and certainly at an unspecified date, because the wound was still healing at this point. Now, doctor, the next time you saw her was Thanksgiving holiday at North Shore? Yes. Why did you see her at North Shore? Well, it was over Thanksgiving holiday. Defense counsel, objection, Your Honor. The court overruled. The office was closed, and I wanted to see her if there was any debridement to be done in a place where I would have the materials available to do that. And North Shore was sort of a little closer for them, so we met in the emergency room, the waiting room. Then we went up to it's called a minor operating room. Was she admitted to the hospital that time? No. I just wanted to use the hospital facility if I had to do any debridement. Did you examine her at that time? Yes, I did. Was there any treatment necessary? No. By that time, she had actually healed. I had anticipated it would take a lot longer, but actually the wound, once it granulated, it closed quite quickly. Now, after it had healed, did you see her again after that? Defendant's counsel, objection on the ground of relevancy. The court, objection overruled. Yes. And when was the next time? That was December 30th, 1991. And would you read the first part of your December 30th note we've read, and that pertains to the North Shore contact? Yes. Let's go to the second part. What did you find that day? Today, I see her. Everything is healed reasonably well. The right areolar area, however, is quite abnormal looking, with scarring in the superior two-thirds. This is going to have to be revised for a better appearance. Let's stop there. Did you tell her that? Yes. Continue. There is also some widening of the scar along the inframammary line lateral to the vertical line. This should soften up and lighten in color and probably not be a problem, however. Doctor, with regard to that very first contact you had with her back on March 27, 1989, when we talk about widening of the scars in that note, is that what this refers to? Yes, it is. Okay, now continue. There is still quite a bit of thickness in what is probably the pedicle beneath and behind the area. I will see her back in June when she has completed her semester at school, and we can sit down and discuss an approach for treatment at that time. So at that point in time, had you finalized exactly how she would be treated? Defense counsel, I object, Your Honor. The court, objection sustained. Why did you want to wait? It takes a long...
That was good.